Well, so welcome today. I'm glad you guys came. I don't know if, we probably are, I'm not sure we're going to get anybody, and if they do come in, you're welcome. But, so in the last couple years, I've kind of talked about integrative medicine, because we do a lot of that at the vet clinic, but this year, we decided we'd talk about Lyme disease and anaplasma, or anaplasmosis, which definitely can affect your pets, and can affect us. So unbelievably, I found a clock that had ticks on it. So this is the Tick Talk. And the things we're going to talk about today is, what are ticks? Why do we even care? Why am I even trying to teach you what they are? It's because of what they carry around. What is Lyme disease and anaplasmosis? Wow, typo. How does it affect my pet? How can we treat these diseases? And how can we prevent them? So, show of hands. Do you guys think... put your hand up if you think ticks are insects. Okay. Put your hand up if you think they're spiders. These are trick questions.
They're probably all of these.
Okay. Put your hand up if you think they're parasites. All right. Cool. Let's look at this a little further. Do you remember when we had to learn that? You might not. But that was in Biology 101. So in the animal kingdom, the way they break these creatures up is like if you got a spine and a skeletal system, and if you don't. So ticks don't, so we're over here. Oh, I forgot I was on that. Dang it. So, oh, I gave you the answers. Okay, so ticks are in this family, arthropod, but they're arachnids. Does that sound familiar at all?
Spiders.
Spiders are arachnids. So remember, I said, are they insects? Well, technically they are not. Okay? Because in one life stage they have 6 legs, but otherwise they don't. So ticks are arachnids. They're not insects. And actually, they're not spiders either, but they're cousins to spiders. Okay? So, these are the arachnids. And there's some other weird stuff in there. Yeah, this is not for the faint of heart. There might be one disclosure here today that gives you guys nightmares. But arachnids are scorpions, spiders, mites, ticks, and then there's some other weirdo ones that you really see a lot. So they're in that family, but they're not spiders. So, can ticks jump? Set of hands up if they can jump. Actually,
no.
Ticks cannot jump, but spiders can. And that's where I'm sorry if it gives you nightmares, but there are jumping spiders. No jumping ticks, but what do ticks do? What do you think this tick is doing? He looks like he's getting ready to jump.
He's looking for me.
Latch onto something.
Exactly. So this is called questing behavior, and they just sit out there, and they have ways that they can kind of sense carbon dioxide in the air. Some of them sense vibration. Some of them it's maybe a smell thing. Some of it's temperature changes. It's really cool. They even think some of them can tell like when shade is coming. So like maybe somebody passing by. What the heck, huh? So, and then they catch a ride. So that's how they do that. Back to those questions. Ticks, we know now they don't have spines. They don't have vertebrae. They actually have 8 jointed legs. All arachnids have 8 legs. And they don't have antennae. Arachnids don't have antennae. They're not insects. They're not spiders. And they don't jump. I asked the question about parasites, and you all got it right, I think. So they are parasites. They stay on the outside of our body, so they're called ectoparasites. What that means is they live off the life force of something else, okay? So they suck our blood, they suck the blood of birds, and they suck the blood of reptiles. They are divided into 2 different categories, hard ticks and soft ticks. We're just going to talk about hard ticks. Those are the ones that we're most used to and most used to seeing. But all of the different ticks can carry diseases, and some of them are not good. So the common ticks around here are going to be the deer tick and the American dog tick. Do you need me to shut that?
Yeah, that would be nice.
Yeah. So those are the 2 that we're most used to seeing. And this one over here on your left, that deer tick is also called the black-legged tick. The American dog tick is kind of the also common tick we see around here. So let's look at these a little bit. I'm going to give you a quiz. No, I won't. But I do want you to sort of know what you're looking at if you come in with a tick or if your dogs have a tick. These ticks, this is the American dog tick. This scutum is what it's called. This area on the top is pretty white on the girl American dog ticks. The guys are kind of mottled all over, but they have a lot of light and dark. There's a lot of difference between the colors there. These are fairly large ticks. They're easy to see. This is, you won't see like a pattern with the dark in there. It's mostly white. These guys can get quite big. They carry diseases we don't see a lot around here. So at least at this point, doesn't mean we won't. And I'll kind of mention that later. Oh, back there, I was going to tell you where they're, where these guys live. Dermacenter dog ticks live in a good part of the United States. They live here and they live over here. There's also a different Dermacenter tick that lives kind of in the Rockies and along there, and that's where we get that Rocky Mountain spotted fever. So the black-legged tick or the deer tick are the ones that, you know, send fear through us when we find them. These are smaller ticks, but they got really big mouth parts, which we're going to look at that in a minute too. So these guys have this really dark spot that's right behind their head. It's very dark, whether they're in their nymph or larva stage or in the adult phase. These guys can get super huge when they take blood meals. Well, not super huge, but they get quite big, and they're easy to find. They can get like over 100 times their weight, so it's pretty crazy. These are the ones that are carrying Lyme and Anaplasma in our area. They can carry other diseases as well, but these are the bad guys. Now we see where they're located. They're more in the eastern part of the United States and in Wisconsin and Minnesota, and that's where we have really heavy Lyme and Anaplasma. So, okay, this is the brown dog tick. I'm not going to say you're not going to see it, but we don't see it a ton here. It apparently can live here, but it doesn't hang out here as much as other ticks. This one can carry all of it can carry your Anaplasma. It can carry your Ehrlichia, Rocky Mountain spotted fever, and babesiosis, which is another blood parasite. So and I'll talk about those diseases in a minute. But so that one, you can just see it's all kind of the same color. Mouth parts are not real long like the other one. Here's a long mouth part here. So these guys are Lone Star ticks, and they're known for like being in the southeast and in Texas area. Scary part is with our weather changes and with the temperatures getting warmer, they're moving north. Okay, so these guys also can carry some nasty diseases, and they're diseases we don't see a lot around here, and we don't want to. Okay, because some of these diseases can be really bad. So, and unfortunately, a lot of the diseases that our animals can catch, we can catch too. So this is how ticks feed. When they eat, they actually make a hole in the skin. They kind of pick it apart, and then they just shove that mouthpiece, this thing, right down in the skin. So this one might give you a little bit of a shake. There's these little barbs that you see. That's what keeps them in, and that's what makes it hard to pull them out. Because they're in there, they're creating inflammation, and there's blood there, and they're just sucking away. So we're going to remember that when we talk about how things move. Maybe I should stay over here. So let's talk about the life cycle of the tick, because, oh gosh, oh, sorry. So we're going to talk about the life cycle of the tick. How long do you guys think deer ticks live? 3 months? You think they can live 3 months? 1 year? 2 years? Actually, it's a 2-year life cycle for these guys, and they can live up to 3 years. A lot of these guys will die before they can actually go through their whole life cycle. These guys have a life cycle that involves 4 different parts. Their eggs. Once the eggs hatch, they become larvae. The larvae are 6-legged, really small little guys that you might think, if you found it, actually you might think it was a spider because it's 6 legs, and ticks have 8 legs. So this is kind of weird. So you can see this winter, spring, summer, fall. The 2 coils are like 2 years. So this larvae, once it hatches, it's going to grab onto a mouse, maybe a bird. We think with Anaplasma, maybe the turkeys have kind of spread some of that, so that's a little interesting, because we definitely have wild turkeys around here. It's going to take a blood meal and fall off. It's going to do a molt and become a nymph. These are really small, you guys. These are like pencil point, okay? It's going to become a nymph, and then it's going to hook onto somebody else. It might hook onto another mouse, or chippy, or something like that. It might hook onto a deer, a dog, a person. So in that nymph stage, then it's going to take a blood meal, fall off, and it's only then that it becomes an adult. And as an adult, it's going to take 1 more blood meal, then it's going to reproduce. So when it takes its blood meal, its ultimate host is really the deer. Okay, so 4 life stages, 2-year life cycle. They feed 3 times throughout their life. Okay, if you follow that coil. They can actually live for up to 3 years, and they pick up the bacteria that causes Lyme disease and Anaplasma from small rodents and birds. So way back at that larval stage. So their eggs, and then their larvae. At this larval stage, that six-legged thing, when they jump onto that first mouse, that's where they can pick that bacteria up. Then they shed, become a nymph. They can pick it up there too, yeah.
When they're nymphs, can they pass the Lyme disease on as a nymph, not, or just
no.
as an adult?
No, they have to shed, and then as a nymph, absolutely.
They
In
can-
fact, nymphs are when they usually do pass it on,
Okay.
because they're so small. In people, we can kind of, yeah.
Maybe you're gonna get to this, but it just seems to me like, aren't the percentages small if they can get 3 blood hosts during their life? I mean, they're out in the middle of kind of nowhere.
You know, I think if you counted the amount of ticks that are there, the percentage would be small, but there's so many ticks that even, like in Minnesota, I think like only 3 or 4% of bats carry that skunk variant of rabies. We see rabid skunks every year. I mean, rabbit, well, we see that too, but we see rabid bats every year, so it's like, it's such a small number, and yet there's enough of them that you're going to see it. Same with these guys. Look at how teeny these tick sizes are, that larva. Look at how, I mean, that's, compared to a dime. So these are really, really teeny bugs when they're in their really young stages. So why do we care about, oh yeah.
How do they survive the winter? Are they in our houses?
No. Well, some ticks know how to do that, but these guys don't so much. So they're the brown dog tick probably knows how to live in your house, and soft ticks can. They're like under leaves and matter. They just kind of crawl under and just kind of sit there, and then they become active again in the spring.
So they kind of hibernate.
They do, but some of the ticks don't do as well in the really cold weather. Thank God. It's just that if our weather changes enough, we're going to be seeing all these bad boys coming in. So why do we care about them? Well, this up here is a photomicrograph of actual Lyme bacteria, or Borrelia burgdorferi. Down here, we see this at the practice sometimes. This is a white cell that has an anaplasma organism in it. So that's why we care what's biting us. So let's go back to that life cycle thing. We got the eggs. This mama one lays her eggs, and what hatches is this larva, and it's not quite in the normal look yet. It's going to hop onto small mammals usually. It can be birds too. Does a molt. It doesn't take a big blood meal. First blood meal here. This is where it picks up the bacteria and the anaplasm. Then it becomes more like a tick that we would recognize as a tick. And that's when it can become infected to us, or it can hop onto somebody else for a bit. It can pick stuff up there too. So it doesn't, maybe these are clean mice, maybe these aren't, right? So, and then once it takes that second blood meal, then it becomes this nymph. And nymph is the stage that we actually think is responsible for most of the human transmission of anaplasma and Lyme, and probably dogs too. Then it takes that last blood meal, and then it goes, it wants to go to the deer, but it would go to people or dogs or anything it finds. So where that bacteria comes into the cycle is down really early at that larval stage. What happens is it takes its nasty pinchers, makes its hole, sucks its blood. When it's sucking that blood, that bacteria, I'm just going to talk about Lyme right now, but the bacteria goes into what's called the hindgut of the tick. It sits there. It doesn't kill the tick. It's kind of in suspended animation, if you will. And we know that, well, with anaplasma, it can probably pick it up within 12 hours of a blood meal. With Lyme, we think it's closer to 24 to 36 hours. We really don't know. We used to say 48 hours. We know it's not it now. We really don't know how quickly that tick, whether it's a larva or a nymph, can start picking up enough that it's going to pass it on to the next guy. So you can see it just collects more and more. We've all probably seen those on dogs. Yeah. So then when they do get infected, what do we see as an actual Lyme? Okay, so this is a really sad lad that's not eating, so I had to put that picture up. So these dogs come in, they're limping, and they may have what we call kind of a rotating lameness, where they're limping on their front and then they're on their back, and you're like, where are they sore? Because it's hitting all the joints. They oftentimes will have fever, those swollen joints. They're not right. They just don't feel good. ADR stands for ain't doing right. They're not eating. They can eventually develop kidney failure Or it can be a silent infection. These are hard ones, guys, because this is what probably leads to this, okay? Silent infections mean you really don't, they're your dog, they're fine. Aging pets that already have arthritis. Big category for silent infections because, oh, they're just getting old. They're just creaky, you know? So, clinical signs of anaplasmosis. Let's talk about that. Low energy. They can have high fevers, swollen, painful joints, don't want to eat, maybe some vomiting and diarrhea, maybe even bleeding on those guys. Also silent infections. Does that sound familiar? Yeah, right? They both can look a lot alike. We can also see lymph node enlargement on these dogs, some eye changes, so there's other things that we see, but those are the most common ones. On people, they get these target lesions that can sometimes tip us off, and those can come on between 3 and 10 days after a bite. So I mean, those might make you go, oh man, you go in, you get put on you know, an antibiotic right away, done deal. But dogs don't get those rashes. Thankfully, our kitties seem to be pretty fairly resistant to that infection, so we don't tend to see Lyme disease in our cats. However, I do treat a couple patients every year that are really outside a lot that I treat them for tick-borne diseases and they get better, so I'm pretty sure some of them do get it. They probably don't leave the tick on long enough is what I'm thinking.
So why do they figure the cats don't?
I think because they pick them off. I think, 'cause, you know, they're like, oh, this is bugging me. Ticks actually, you know, can bite like 3 times or so before they find the spot they really like. And we'll talk about what spots to look for. But so the diagnosis of this disease is really going to come from lab work. So we have lab work that just, you know, tells us positive. It tells us I've been exposed. I've had a natural exposure to anaplasma, to Lyme disease, Ehrlichia, or heartworm is the one that we do. We also can see it on our blood film, so we know that. There are, obviously if you're worried about, you know, Lyme-associated kidney disease, chemistry is going to tell us that. The treatment for Lyme disease is pretty straightforward. I mean, it's not usually too expensive unless the pharmacies are messing around with things, and sometimes doxycycline can be hard to get. But we do a 4-week course of doxycycline. During that time, it's best not to give the patients any dairy, because the dairy has a lot of calcium in there, which will bind up the antibiotics so it can't be active for the animal. The treatment may require hospitalization, but it usually doesn't. You know, when we have kidney disease, those animals would have to be on intravenous help, but generally they're going to be at home. You're going to be given the antibiotics. Sometimes, you're welcome, come on in.
No, I'm just looking to see if there's a pair of sunglasses like
Oh, don't know that. You can come on in and look for that too. I didn't see one here. I do follow up with these guys with probiotics to just kind of repopulate the gut, because this is 4 weeks of an antibiotic that's really going to change the bacterial composition of what's in the gut. We can use vitamins and things to build our pets back up. There is some evidence that using stevia, no, it's supposed to be certain stevia, can help some people, and I've used it on some animals now, to get rid of residual Lyme infections. I've also used some homeopathics that seem to kind of, sometimes I'll have patients and my clients will say, oh, they just haven't been the same since that infection. You know, a lot of people who are in that, you know, in that category. So the chronic kidney failure thing is, it's more common if the Lyme disease goes undiagnosed. So that gets to be, you know, a little trickier. And it's serious, and they can often die. We also see it more when there's co-infections where they have Lyme and anaplasma. They're just getting hit. Follow-up here, you know, is going to be maybe rechecking a blood count, make sure they got platelets again, make sure you're not seeing those organisms. There's a blood test that we run for animals. I don't know if they do it for people. It's called a quantitative C6 antibody. That C6 antibody is only made by the animal if there's been a natural infection. So nothing else is going to give us that. So we don't necessarily know if the animal has fought it off itself, but we know it's been exposed. And the one thing you got to remember, guys, is if your animals are coming up positive for Lyme, you're usually in the same environment as your animal. You've probably been in the same environment. You could have been exposed. And I tell clients that a lot. You know, hey, if you got some weird, you know, joint stuff, you might want to tell your doctor that your dog is positive for Lyme, because sometimes that's how people find out they have chronic Lyme disease. So, and we do yearly tick screening on these guys. So what can we do to prevent it? We're going to talk a little more about what happens in that, in the hind gut of that tick. Okay, so remember that the tick attaches, it's taking its blood meal, all the bacteria are in its hindgut. Now it goes on to somebody else, and it's got these bacteria there. As it's feeding the blood, the bacteria get turned on, and there's different proteins that come on the outer surface of that bacteria. And one, we call it OSPA, but it's outer surface protein A. So that happens, which then makes these bacteria become active. They migrate to the mouth part, and then the tick spews them out as they're taking their blood meal. So, and that, here they say 48 to 72 hours. It's like, yeah, I think it happens a little quicker. So we can vaccinate dogs for ticks. We don't have a vaccine for anaplasma. The vaccine for Lyme is pretty interesting. It's a 2-booster series initially, and then it's yearly thereafter. That OSPA, remember that outer surface protein A that I talked about? Well, we know that there's other outer surface proteins, but with the vaccines, a lot of the vaccines actually make the animal make antibodies against that particular thing. So in the end, the tick is eating, the blood's going to the hindgut, the bacteria get activated, that outer surface protein comes, but now the blood coming from the animal has something that's going to kill these guys before it even leaves the tick. That's pretty cool. So that's really what happens with Lyme vaccination. We're killing it in the tick before it goes into the animal. Because we don't have a good vaccine to kill it in the animal. We don't have a vaccine to kill it in people. In fact, the whole, development of the Lyme vaccine in the dog started with Lyme vaccine development in people, which failed. So, but we learned stuff, thankfully. All right. So the other way we can protect our animals, other than vaccinating, is monitoring. We got to find the ticks on them. So there's a lot of different, ways you can check for them. They have little things saying this is where ticks like to go, which is true. They really can be anywhere. So they tend to go to areas that maybe are warmer, in creases, maybe don't have as much hair. So if you find a tick on your pet, it's really not recommended to put a lot of stuff on them and see if they'll back out. You really want to get it off right away. So they recommend taking a tweezer. Don't squeeze the head, but kind of at the base and pull up. So you can see that this thing isn't totally squishing. It's just holding it, and you pull straight up. Don't be twisting it. Don't turn it. You're probably going to sever the head if you do that. So if you pull straight up, you won't be as likely to sever the head. Okay, there's other tick preventative products. The newest ones are oral products. I put a few of them on here. And they actually, it's kind of interesting what they do. They basically affect the nervous system of the tick, so the tick dies. So the tick is taking its blood meal. There's topicals that are long-acting, and there's collars. This is probably the only collar I would recommend if you totally love collars. Most collars don't work for our pets. There's natural products that we can use. A lot of them contain essential oils. There's an herbal product that you can give orally in their food for the first 5 days of the month. That one works good, but sometimes animals will get diarrhea from that, which tends to be a little negative. So the natural stuff, though, it's where my heart is, and I want to say it's great, probably doesn't give us quite what we need. Also, just a healthy lifestyle. Keeping these guys healthy through vitamins, mushroom mixes, different nutrients that we know can bolster the immune system. Good food, lots of exercise, kind of like us, healthy lifestyle stuff. So in a nutshell, ticks are not insects, they're not spiders, and they can't jump the quest. Okay, the American dog tick and the deer tick are the most common ticks here. The hard ticks like these have 4 life cycles, and they take 3 blood meals. Dogs can get Lyme disease and anaplasmosis from ticks, feeding on them for at least 12 to 36 hours, and the younger life cycle ticks are more likely responsible for the infections, the little guys. We can treat them if we find it fast enough. People can't get Lyme disease or anaplasma directly from their dog, but they can get the tick that's carrying it. And I feel like when I use, these oral tick protectants are I feel like they work a little better on my dogs at least. But I feel like I end up with more ticks if I fall asleep on the couch with them. So I'm just saying, just watch. So, and of course, last but not least, it's not the deer's fault. Really, it's not. That poor deer tick. It's like, it's not the deer. So, I'm sorry. I had to go really fast because I wanted to present all this information. But do you guys have any questions? Is there anything that I can answer for you? Yes.
Again, so a tick bites the dog.
Yes.
How long is it before the mommy and daddy say something's wrong?
Okay, that can be really variable. That's a really good question. So you can have those silent ones where they never get sick, or it can happen within a couple weeks usually. With people, so Lyme infections it starts as a skin infection, okay? I mean, it starts at the level of the skin, that's where the tick is doing it, and then that organism spreads. So thankfully, we get a skin reaction right away, so it would drive us to go. Dogs don't get that. They might get local irritations, but they can get that from any tick. So it's really unknown sometimes how long it's going to take from bite to the animal actually showing signs. It might be a week, a couple weeks, it might be months if they go down that kind of silent infection pathway. And that's the hard part. However, it's really interesting because I have a lot of dogs that we screen every year, every spring. And when they show up positive, a lot of times they're not clinical. And so people are like, well, I don't know. But now they're thinking about it, right? And then within a couple weeks, I tell them signs to look for. Within a couple weeks, they're calling me back going, she's just not acting right. And we run them on the doxycycline, and they're better. So it takes a while. It can be weeks to months. Yeah. Some of them can be even in there for years. And it just, it really flies under the radar because the immune system is beating it down. And then the immune system isn't strong one day, and it gets through and causes all the problems that it can. Yeah.
So you want to give them the tick medicine every month, right? All year long?
Generally, I mean, you follow the directions of whatever tick preventative you're using, but yeah. So the oral ones are either once a month. Bravecto is every 4 months. And I don't carry Bravecto. I don't mind if my patients are on it. It just freaks me out, a drug that will stay in the body for 4 months. It's just, I can't do it. Because like if you have a reaction, what do you do? Okay, talk to me in 4 months. So I just have a problem with that. But yeah, it's once a month is what's recommended. Now, I'm not going to say that some of us don't stretch that out a little. And it seems to work. I think these tick protectants work longer than 4 weeks. At least what I see on my own dogs.
It's not that much a month, right?
It's not that much a month.
The cost?
I don't know, you gotta ask Denise that. I try to not pay attention to anything money.
The monthly chewable runs probably between 20 and 23, just depending on the size of the dog and what one we need.
Really?
So yeah.
Yeah, I think that's
The Heart Guard is only like 10 or under, but
The preventive medicine is a lot cheaper than having the
Treatment.
yeah, well, maybe. I mean, if you cut it early, I suppose you preventative might. But you don't want to go there. I mean, you don't want to go there. Yeah, just like on yourself, you don't want to go there.
But what about the injection? I don't know that I knew that there was.
The vaccine?
Vaccine, yeah.
What
That's
about-
once a year. How is that cost-wise to me?
That's initially, it's a little bit more of an expensive vaccine, but then it's just once a year. I think it's between $20 and $30.
yeah, and it goes by weight too, so it depends on the size.
vaccine doesn't.
Or that one doesn't go by weight? Oh, okay.
So, yeah, so that one is
Okay.
it's not, yeah. It's usually $1 or so more than Frontline for the products. For the vaccine, it's going to be more than some of your other ones. It can come in combo, which makes it a little cheaper, but not all dogs need all of the Mammocom vaccines.
So it's a good thing it doesn't go by weight, so you don't get penalized if your dog's overweight a little bit.
Well, right? Are there any other questions? Have I completely bored you? Sorry. I talked way too fast. But hopefully you'll at least learn something. And if it's that spider's jump, I'm really sorry to let you in on that. So thank you for coming. I really, really appreciate it. And have a great summer, great spring.